Hey everybody, it's that time of the week again, and we've got a lot to go over, so let's jump in here. All right, with regard to vaccines, please understand that we are seeking and receiving information on this topic from multiple sources, and it's coming down from the feds to the state, and then we're receiving and seeking information. And it's also coming together really quickly, so we should expect information that's sometimes changing and sometimes unclear. So please bear with us as we try to make sense of all this information and provide you with information that's timely and doesn't contradict, but understand that sometimes it's going to be a little bit unclear, and we're trying to make sense of all of it. All right, as we understand the process, the emergency use authorization will be likely approved today by the Food and Drug Administration. It will then go to the CDC ACIP committee on Friday and will then be likely approved by Sunday, on or by Sunday. Then vaccines are going to be immediately starting to be shipped out to states, probably Sunday through the 15th. So by the 15th, they should be to the states. Provided this emergency use authorization is granted, Kentucky facilities are expected to start doing clinics on the 21st for Pfizer vaccines and Moderna on the 28th, depending on which vaccines Kentucky receives. And my understanding is that we either are going to receive Pfizer vaccines or Moderna vaccines, and it's one or the other. We don't get a mixed bag, which kind of helps with follow-up because they require a different length of time in between the vaccines. This gives pharmacies 2 weeks to schedule clinics, and then also for facilities to get consent forms completed. Now, speaking of consent forms, because the emergency use authorization hasn't been approved, consent forms are still not formalized or approved yet. So I know there's been some confusion about consent forms. This is understandable. So because the emergency use authorization hasn't been approved, there's no formal consent form yet. So there's been rumors about whether it's going to be electronic or whether it's going to be the triplicate form. What we have heard is that CVS form is going to be electronic and Walgreens form is going to be the carbon triplicate. I know that AHCA is pushing back on Walgreens and is asking them to switch it to an electronic form. We will keep you posted on that. We know that the carbon forms are more laborious and take more time, and they're just not as easy as the electronic forms. So we will keep you posted on that. We have also heard, and I did not include this, I'm just thinking of this as I'm speaking. We have also heard from AHCA that verbal consent is not going to be acceptable, but we will let you know as more comes out about that. All right, facilities. The Department for Public Health has let us know that the state received a list of facilities in Kentucky that have been approved to receive vaccines. By noon today, that list will be going back out to Walgreens and CVS, and this is the final list. It can't be changed. We're working to get a copy of that list, and once we get a copy of that, we'll be sharing it with you all. All right, let's see. So with regard to this has been a big question. We've gotten this a lot. So it sounds like facilities are going to be scheduled for 3 different clinics because there is, we know that there are going to have to be 2 vaccines given to each person. So in order to make sure that, individuals get their 2 doses, there will be 3 clinics set up for each facility. But the question has popped up, well, what about if a resident is coming for a short stay and they're only there for one of their vaccines, like they come at the tail end and they come just for that last vaccine? Well, we've been told that, let's say that resident comes from the hospital. If they come from the hospital, they will likely receive their vaccination, at least one, prior to their arrival at the hospital. So they'll receive 1 vaccine at the hospital and then they'll get their second one during one of your clinics at your facility. But with regard to those individuals who get 1 vaccine, if you have your very last clinic and then they get their 1 and then they are left not getting their second vaccine, there are still discussions that are ongoing with regard to those folks. We don't know. And then there's also some discussion about facilities who decide to split their staff up between 2 clinics so that they aren't suffering side effects at the same time. We are hoping to hear from Pfizer and CDC with regard to guidance on this next week. So be patient and look for that guidance next week. All right. From the Department for Public Health, the vaccine website is operational. This is on the state's website. I would strongly recommend taking a look at this. They have some really good information on their frequently asked questions. So please go out and take a look at this. We've included a link here. The Department for Public Health has also a recent presentation that not only touches on the COVID vaccine, but it also gives some updates on the flu, COVID reinfections, which is a really timely and something that I know a lot of people have questions about. The Binax now, I think that's the point of care device, and some other information. So it's kind of a rich presentation. So take a look at that. Like I said before, the state's going to either choose or receive Pfizer or Moderna. It's all one or nothing, but it's all one or the other. We're not going to get like a mixed bag. We have heard that Pfizer has a very good education video and materials on how to do these temporary clinics. I've reached out to try to get and locate this video, and I've had a hard time locating it on Pfizer's website, but I've reached out to try to get a copy of this or a link to this video. And as soon as we get that, we'll be pushing that out to you all. Once we do know, we've been asked the question, like, what about once residents or staff receive their first dose, does that mean we can stop wearing masks? What we've heard from the Department for Public Health is once the first dose is given, it is 50% effective. After the second dose is given, it's over 90% effective. But the Department for Public Health and presumably CDC will tell us that it is really important to continue wearing masks and using PPE because not everyone will be vaccinated. Hopefully we will be on all of this as time goes on and as the infection rate drops. So hang in there. Let's wait and see how things go and as time goes on. All right. From the OIG, we know that CMS has not given a directive with regard to testing after the vaccines are given and as time goes on and infection rates drop. So again, let's be patient and see what the guidance is after vaccines are given and we know that that's all completed. A new toolkit, if I could speak today, was created by AMDA that aims to help long-term care operators address questions that staff members or residents might have or family members asking about the vaccines. And I have included that toolkit here in your update. Pharmacies, like we've talked about, pharmacies other than CVS and Walgreens are going to have to wait until later, an unknown date, because Walgreens and CVS are going to be the first to receive the vaccine. And then we've talked about how the vaccine will be billed through the pharmacy to individuals' insurance, and then other individuals who do not have insurance, it's going to be fully covered by the government. And then I've been asked several times if staff or residents refuse to receive the vaccine. Right now, as far as we know, it's still believed that they can't be required to take it, but we hope that we will be receiving some federal guidance on this topic. Okay, so with regard to testing, because this is the other thing that we know we've been getting a lot of questions on, understandably, it is, nothing is good news right now. With regard to testing, the state will run out of CARES Act funding that has been supporting that state-funded PCR testing. That funding will end as of December 30th of 2020, so in 20 days from now. That funding runs out. Also, as of that last week of December, that $21.64 reimbursement for the sample collections that facilities have been using will dry up as well. So make sure you all are utilizing this benefit as much as you possibly can until that time, if you have already contracted to do so. What we do know now, and hopefully you all will know more here in the next couple days because we will be pushing it out to you as soon as we possibly can, is that the state is working on a bridge plan, what they're calling a bridge plan. In the meantime, a couple things. First of all, if you have any antigen or point of care tests available sitting on your shelves or that you've been using, what the state is advising is that you start alternating these. with the PCR tests that the state has provided from now until December 30th. That's just a recommendation, but they've advised that we pass that along to you all. Also, next Monday and Wednesday, the Department of Public Health will hold seminars on how to make requests for some testing supplies that the state is likely to be utilizing for some bridge testing. We don't have specifics on the time that these trainings will be held or a link, so I haven't included any of that in this update. But as soon as we have that, we will send that information out. But what I wanted to get to you is next Monday and Wednesday, these seminars will be held by KDPH. Please mark that on your calendar to be aware and to be looking for further information, because that is going to be your information on this bridge plan. So important information. Be looking for more information on a training next Monday and Wednesday from KDPH on this bridge plan. All right, again, we are supposed to be hearing more either today or early next week. We've asked for a meeting. Actually, I just sent off an email again earlier today, just a few minutes ago, asked for a one-on-one meeting with the cabinet to go over line by line this guidance because we have so many questions about it. So that unfortunately may delay this going out, but we really need to parse through this because there are so many questions that we have. So sorry, but we're trying to get make sure that this is so clear before it goes out, which, you know, inevitably there will still be questions. But okay, so that being said, it was supposed to go out today, but it may be tomorrow or Monday before that comes out to you all. All right, for what we do know also is in this plan that AL and PC will go to testing every other week, regardless of the county's color on the map, and will continue the state-supported PCR testing, unlike what we know SNFs will be doing. So just to kind of put that out there, AL and PC are going to be different, supposedly. I know, and what we keep being told by the cabinet is that all of this is still in the works. All right. All of that being said, I'm taking this as my, I don't want to put this on anybody else. I'm still strongly advising you to continue to build a contingency plan. Please check with your current testing partner, your lab, to ensure that they'll be able to continue serving you in the coming weeks and then after December 31st. If not, please work on securing a new testing partner. Again, this is what we did last week. I've included in this advisory a list of the entities that are currently working with the state as a starting point. As far as testing frequency, the state did check with Region 4 with regard to frequency because we know that the frequency that y'all are testing at, it's too much. And our state knows that. And other states are saying the same thing. Regardless of our feedback to Region 4, CMS Region 4 responded that they don't expect testing frequency guidance to change at this time. That's very disappointing. But that's where things stand at this time. All right, so getting away from testing, and I know everybody is probably going to have a lot of questions, and like I said, we are working on trying to clarify some of this guidance and hopefully get it to you as soon as possible. So going on to CMS update, there's only a little bit. CMS issued new nursing facility COVID testing frequently asked questions. It's really valuable. So it includes some guidance on testing in nursing facilities. It talks about like a lot of questions that have been long-standing. So like false negatives with the point of care antigen tests, triggering of outbreak status, testing of emergency medical personnel, and clarification on turnaround time for tests. So we've included the link for that document in this alert. And HCA, there's a bunch of information in this alert from HCA, but the main thing that I want to highlight right now is that IRS has put out an alert about a COVID-related text message scam. Sorry. The thief's goal is to trick people into revealing bank account information. So just keep an eye out. I've included all the specifics here, but just keep an eye out for that text message scam. I believe that is all of the most important information here. But as always, if you have any questions or any concerns, don't hesitate to reach out to any of us on staff. We are always available and more than willing to help you. This was a long one, you all. Sorry. But reach out anytime. We're always here, and have a great weekend. Thanks.